women after the menopause have less estrogen than a man.
I'm not waiting till my house is burnt down before I call the fire brigade.
Even within the medical profession, your is a common thing that's heard.
Can you take it forever and ever and ever?
So this with HRT.
Don't suffer in silence.
If you've got symptoms, that's what HRT's there for.
Right. A very warm and overly excited welcome to No Appointment Necessary. My name is Cherry Healey.
And I'm Dr. Amir Khan. I'm usually up at my surgery in Bradford, but once a week I come down and record this podcast for you. No appointment necessary.
Do you see that subscribe button? Well, you should hit it because then you'll never miss an episode.
Yes, and if you haven't already joined our Facebook community group, there's over 23,000 followers now on there. Amazing. Come and join it and you can ask us any questions. And that's what this episode's all about, right?
Yeah, this is a mega episode. We're going to be talking about HRT, and you have sent in so many of your questions via Facebook and Instagram. We're going to answer as many of them as we possibly can. I'm going to split this into two sections. We're going to split it into section one, which is people who are not on HRT, who've got questions about HRT, people who are already on HRT.
Yeah. Okay. Sounds good.
Are you ready?
I'm ready.
It sounds like gladiators.
It does.
Are you ready? Thank you so much to every single person who sent in a question. We're going to try and read out as many as we possibly can, but we can always follow up in another episode.
Yeah.
Well, first of all, what is HRT?
Well, HRT is hormone replacement therapy, and it usually consists of estrogen, which is the main thing where we're replacing, because with the menopause, estrogen levels drop, as do progesterone. But we generally give progesterone to manage estrogen because you can't give estrogen by itself to certain women, particularly those with a womb, because too much estrogen, we call it unopposed estrogen, can increase your risk of womb cancer. So the progesterone balances that out. Now, we give it to women in the perimenopause where estrogen levels are fluctuating, or the menopause or postmenopausal where levels have dropped, because, and I think this fact is really interesting, women after the menopause have less estrogen than a man. Less estrogen than a man.
Oh, so I mean, it doesn't just deplete, it really leaves town. It's gone.
It's gone. So estrogen is mainly produced by the ovaries before the menopause. After the menopause, the ovaries do just shut up shop. They say, right, no more estrogen for you, thank you very much. So the main places where women get that little bit of estrogen that's still around is their fat cells and a little bit from their adrenal glands as well. But if you think about it, all that work that estrogen's been doing up until the menopause for those women is completely gone. When I say to women, after the menopause, you have less estrogen than a man, it kind of blows their mind. Men will convert some of their testosterone to estrogen. So men will make testosterone all their lives, and those levels don't really drop that much. There's a tiny drop as you get older, but it's not significant. And all the way through life, some of that will be turned to estrogen. So that they never have that hormonal cliff to drop off like women do, which is why HRT is so important.
What do estrogen, progesterone and testosterone do?
So estrogen, it's really hard for me to narrow that down because estrogen plays a part in almost every aspect of a woman's life. So her brain, her bones, her blood vessels, her blood, her reproductive cycle, everything. Estrogen is involved in all of that. That's just that's not an exhaustive list. That goes on and on and on. Progesterone is really important for the reproductive cycle, but also balancing the effects of estrogen as well. It is vital. Testosterone can help with focus. It can help with libido. It can help with bone strength. Lots of different things that testosterone helps with as well. But estrogen is the big driver here.
If after menopause you've got less than a man, how are women just walking around town?
Yeah, and that's the problem in all of this, isn't it? Because that conversation has only really come to light in the last 5 or 10 years or so, and we're really starting to understand what the lack of estrogen does to women, both from a personal kind of day-to-day point of view, but also long-term.
I think the perimenopause and menopause revolution that we're seeing at the moment, women accessing HRT and accessing information, is one of the biggest and most exciting revolutions to happen to women.
Yeah, agree.
I'm excited for this generation. I'm really excited for the next generation.
Yeah.
And I feel that the women before us have been let down badly.
Yeah, I agree. I agree completely. So hopefully we're changing that.
Right, I'm just going to get cracking because we've got a lot to get through. Emma says, how do you know when it's time to ask for HRT, and how do you know which option is best when there's so many alternatives? Great first question.
Okay, so when do you know it's time to ask for HRT is a really nuanced thing, because HRT is licensed for managing symptoms of the menopause, and they can start years before you actually reach the menopause. So the menopause is when you've been 12 months without a period cycle, and there's no other cause for that. That is the menopause. Now, if you've got symptoms of the perimenopause, which can be 10, 15 years before you actually get to that point, you could ask for HRT much sooner. And then it becomes about the risks, benefits, and whether that's the right thing for you. But if you're feeling like, I'm not myself, my mood isn't what it used to be, my energy levels aren't what they used to be, I've got this brain fog that's really bothering me, my joints are aching, I've got no energy, all of those things combined means actually you should have a conversation with your doctor about HRT.
Can I ask you a quick question? Why would you wait if you've got one of those symptoms? So for me, I had really bad anxiety. It was affecting lots of my life and my sleep and everything. And so I decided that I wasn't going to wait for 5 more symptoms. I just went and said to my GP, I would like HRT right now. And she's amazing. She asked me lots of questions and then she gave it to me. And it's been wonderful to live a life without raging heart palpitations and anxiety. Why would a woman wait?
It all depends on whether you, want to take hormones or not. Some people just don't want to take additional hormones and they want to go through the menopause as they do. That's their decision to do that. Some people may have a family history, even though that's not a reason to say no, or a risk factor. That means taking something with estrogen in can increase their risk of a certain illness or problem. And there are some people who don't take to the progesterone part of HRT very well. That's a really common thing where it can affect their mood and make their anxiety worse and cause symptoms. In which case, there are other forms of progesterone that we can now give. There's newer types of progesterone which can minimize those things. So there's several reasons why someone might think, I don't want that. And that's completely personal. But for lots of women, it can be life-changing.
I love it.
I'm glad. I am glad.
Michelle says, even if I'm managing symptoms of perimenopause without HRT, am I jeopardising my longevity in not taking and increasing the risks of dementia, cardiovascular disease, etc. by not taking it? Great question.
No, this is a really personal choice. And sometimes I think, yes, absolutely, we need to be having the conversation about HRT and its benefits. But sometimes what that leaves out of the conversation are the women who don't feel they need the HRT or want the HRT. And then it leads to people feeling, what am I missing out on if I can manage my symptoms of the menopause or my symptoms? Because for some people, the menopausal symptoms aren't that bad and they can get through it and that, they think, well, I'm one of the lucky ones and I've got through it without HRT. But all this talk about HRT is making me anxious. Does it reduce my risk of dementia? We have no conclusive evidence of that at all. I know that's been mooted before, but the studies are really mixed. So we do not link HRT and dementia. Well, the problem is because it's a female issue, there's hardly any research on it. Well, I think there's increasing amounts of research on it, but there's more to be done before we can say it does or doesn't increase or decrease your risk of dementia. What I would say is that we do know HRT, particularly in women under the age of 60, does reduce your risk of osteoporosis, and it can have some cardiovascular benefits. But so if you don't want to take it and you don't need to take it, that's absolutely fine. Do your bone strength training exercises, do your cardiovascular training exercises, eat food that will help manage your heart health and your bone health, manage your sleep. All of those things are super important. And so I would say it's your decision. If you don't feel like you need it, there are lots of things that you can do to counter those risk factors. Can I say something controversial? Yeah. I think for me, perimenopause has been a saving grace. Okay. Because I just can't get away with what I used to be able to get away with. Like, I have to really, really be careful with what I eat, making sure I get enough fibre, enough protein, a really good diet. Exercise massively helps me manage my anxiety. So I go to the gym now because I want to be strong, but I also go because it makes my anxiety less bad. I
sleep is an absolute priority. And alcohol, I have to really manage my alcohol. Like a couple of glasses of wine's fine, but anything more than that, I'm like crazy the next day. So perimenopause has forced me to really, really take my health seriously.
Yeah. And those are the things that you should be doing whether you're on HRT or not.
Absolutely. Kath says, can you start HRT post-menopause?
Yes, and lots of women do. When we're looking at the phases of the menopause, there's four main ones. There's early perimenopause, where you're still having periods and your symptoms might just be kind of on the edges. There's later perimenopause, where your periods are more spaced out and you've got more symptoms. And then there's the menopause, where you've gone 12 months without a period. That's just a moment in time. And then it's your postmenopausal thereafter. Now, women who are postmenopausal, they've been 12 months without their period, still have symptoms of lack of estrogen. It's not like they're out of the woods and everything's fine. They still have problems with their mood, their anxiety, anything else that lack of estrogen can cause, hot flushes, all of those kind of things. So yes, if you've been through the menopause, it's more than 12 months since your last period, you've still got symptoms, then take it. The question then becomes, what if I've been 12 months without a period and I've got no symptoms? Do I still need it? And then it goes back to, well, what are you taking it for? If it is like, I'm just going to take these hormones because I've read it could reduce my risk of osteoporosis, it might reduce my risk of cardiovascular disease. Well, are you doing everything that you could be doing to manage that already? And then it's a balanced conversation that you have to have with your doctor. Is it right for you or not? But yes, in terms of the short answer, you can take HRT after the menopause.
Can I ask a question? What are the different types of HRT that you can take? So I take a gel called Oestrogen, and it's a pump, and I put it on the inside of my right leg.
Yeah.
And I also take a progesterone pill in the evening.
Yeah. I love this. So this shows how, in a way, how women's health has moved on a little bit. So in the past, we would give tablets only for HRT. When you take a tablet of HRT, you swallow the tablet, it goes into your gut. It then gets absorbed into your bloodstream. But before it does that, it has to go to your liver. So we call that the liver first pass. So any tablet you take has to go to your liver first before it gets absorbed into your bloodstream. And what HRT can do in the liver is that it can affect the other jobs that the liver does.
Right.
And the other jobs are managing your blood clotting, managing certain levels of fat, like your cholesterol. So what we found was people who were taking tablets for HRT had a very slight increased risk of blood clots and an increased risk of cardiovascular disease in some people because it affects their fat levels. Now, they're still very small risks, they are. However, when you take estrogen as a gel, a patch or a spray directly onto your skin, it gets directly absorbed into your bloodstream. It doesn't have to go to the liver.
Is that why it's a gel?
That's why it's a gel. So all of those things, the clotting and the fats that, we used to warn people about, we don't have to worry about it with the gels and the patches and the sprays, because it's not going through that first pass of the liver. And so the estrogen gets directly absorbed, and that the risk of blood clots and whatever is not there anymore. And the tablet that you'll take will be progesterone. Yes. You're probably taking a modern version of progesterone, which is a what we call a micronized progesterone, or some people call it a body identical progesterone, because it's really similar to the progesterone that your own body would make. In the past, we would give synthetic progesterones, and lots of people had problems with those progesterones. It used to affect their mood and their anxiety, and people were intolerable to it. But with these modern day micronized body identical progesterones and the progesterone that comes from a Mirena coil, because some people get it via the Mirena coil rather than a tablet, you have much less side effects. That is why most women now have an estrogen patch, gel or spray with a progesterone, either from the Mirena coil or from a tablet.
It also just makes HRT feel much less scary, because obviously the history of it, there have been warnings, whereas I know it's now bioidentical, which just makes it safer. But the gel is just so like, what? You just, just wang it on like that in the morning. It just feels very low drama.
Yeah.
So this is from Christine, Ruth, and lots of others. Can you talk about the HRT effects on endometriosis, and others asking about HRT and the effects on fibroids?
Yeah, so for those who don't know, endometriosis is a debilitating condition where you've got tissue similar to the lining of the inside of the womb in places it shouldn't be. Most commonly, it's in other layers of the womb or within the pelvis, but it can go as far as your lungs, your liver, even your skin. And the problem with that is that it responds to hormones in the same way that the womb lining does. So it can grow, it can bleed, it can cause a lot of pain. Now, the worry with HRT is it's a hormone, and endometriosis is a hormonal sensitive condition. Particularly, it's the estrogen. So there is a risk that estrogen in HRT can trigger endometriosis. Now, the balance here is usually after the menopause, endometriosis symptoms generally decline anyway, but there can still be parts of these little endometriosis things littered around your body. The main issue is giving unopposed estrogen, so estrogen by itself. There's an argument that actually giving this micronized body-identical progesterone balances the effects of that estrogen on the progesterone, so you get less endometriosis symptoms.
Right.
Not always, but that is the best way to do it. And if you are going to do it, generally you're given continuous HRT. So some people take HRT in cycles where they take estrogen and progesterone for a while and then take a break and then go back onto it. With endometriosis, you should take the estrogen and progesterone every single day because you want a stable level of estrogen and that progesterone. But it's worth talking to a menopause specialist GP or a women's health GP if there is one in your surgery, because it is a balancing act. Fibroids, yes, they are almost like knots of muscles within the muscle lining of the womb, but they are hormonally sensitive, but nowhere near to the degree that endometriosis is. But they can grow and bleed with your hormones. But generally speaking, HRT, yes, it can have an effect, but less of an effect on fibroids. It is probably going to cause less symptoms with fibroids.
Wendy says, I was told that as a migraine sufferer, I wouldn't be able to take HRT, and I was wondering if that's right and what's the alternative to it.
It's wrong. You can have HRT as a migraine sufferer.
I can hear Wendy going, woohoo.
Yeah. So with migraines, generally speaking, it's fluctuating levels of estrogen that can trigger the migraine. And if you want to try HRT because you've got symptoms in the menopause, but you're really nervous about the migraine, it's not that you can't have HRT, it's the type of HRT we have to decide which is best for you. And that is where transdermal HRT through a patch rather than a gel and a spray, because we know with the patch, you're getting that continuous supply of estrogen and it's not fluctuating. You have to take your progesterone as well, but you're not getting fluctuating levels of estrogen, can actually mean you can get HRT without it triggering your migraine. The problem with gels and sprays, they are great, but you might not get exactly the same amount on each time. So it can fluctuate the level of estrogen that you're getting. So a patch is better for migraine sufferers.
Good news for Wendy. All right, it's time for section 2.
Yay!
These are the questions from women who are currently on HRT. This is from Alex and others. How do you know when to finish HRT, or can you take it forever and ever and ever?
So there's no hard cutoff with HRT. You should always have, when you start HRT, you should have an annual review with your doctor or nurse or HRT prescriber to make sure that your symptoms are still well controlled, you're on the right treatment, you're not having any problems, your blood pressure's well managed, all of these kind of things. But we never have you have to stop HRT at this age. No, it is always a conversation around whether it's still working for you and whether there's still benefits from you having it. I very rarely do a HRT review because it's mainly done by our nurses, but I never push to stop it. If the lady is really well managed on it, she doesn't want to come off it, there's no real benefit from taking her off it, then there's no reason to stop it. So continue it for as long as you need it, is what I would say.
Can you OD on HRT?
Estrogen's fabulous, but too much estrogen, particularly when it's not balanced by the progesterone, is a problem. When you're naturally making estrogen before the menopause, it is always balanced by progesterone. Right. So if you are slathering yourself in estrogen going, oh, well, I've just put an extra pump and an extra pump and an extra pump.
So the kind of thing I would do. I would love this.
No, you should always talk to your provider about that because we have to make sure that you're on the right balancing act.
Denise says, when you come off them, will you go through all the symptoms of menopause?
That's a really hard question to answer. And some women do, most women don't. If you've been, I would say, a good 10 years since your last period, there's a good chance you won't go through all the symptoms of the menopause. But some women do because we are withdrawing estrogen again. So there's a chance that your body is going to go through it. What I would say is the key difference is we are not replacing all the estrogen you used to have before the menopause. So that drop when you come off HRT is very different to the drop that happened during the menopause. It's a world apart, really. You know, we're only replacing a very small amount of the estrogen. So the chances of the symptoms coming back is a lot less than when you went through the menopause.
Got it. Healey and others say, when you start with HRT, how soon before you feel a benefit?
Not straight away. So if you're looking at kind of hot flushes and mood things,
right,
you're probably looking at 4 to 6 weeks before things get better.
And what I would also say from my personal experience is you're always looking for reasons why it's working. So sometimes you'll be having a good day and you'll go, oh, it's the HRT, but it's very, very subtle. And what I found was that I just suddenly realised that I don't spend loads of my day feeling anxious, and you just suddenly start realising that you feel yourself again, but it's quite gradual.
Yeah.
Well, if it was for me.
Yeah, absolutely. So nothing is straight away. I would say at least a month before you realise
it was 6 weeks for me,
yeah,
I think, really, before I started to think, gosh,
that's about
I feel really good at the moment.
Yeah.
Really nice. I don't wake up feeling like someone's chasing me with a gun, which is good. Louise asks, does efficacy wear off, and what should I do about it if it does? Great question.
It can do, absolutely, Louise. So you might be absorbing the estrogen in a different way just for whatever reason. Your body might have just changed a little bit. So if you're putting gel or patches or sprays on, you're just absorbing it different. Your needs may have changed as well. So you might require a higher dose of the estrogen. And that happens to lots of women as we move through.
And is that a
years.
case of just more gel?
More gel. It could be half a patch extra or something like that. Never do it on your own. Always speak to the doctor.
So the kind of thing
I know. But it's not uncommon for me to say to a woman, actually go from 2 pumps to 3 pumps of the gel, or we'll cut the patch in half diagonally because that's the most accurate way to cut it in half, and we'll put an extra half a patch on and see how you get on there.
Right.
That isn't unusual, and that can happen as your physiology changes as you get older.
But if you feel like it's not working anymore, then talk to your GP, because there's things you can tweak it.
Tweaking it is completely normal.
Georgina says, what about side effects? And when do you know if it's not right?
So there are side effects to HRT. Most of them are driven by the progesterone in HRT. And from my experience, the side effects are just, it made me really anxious. It made me really low. It affected kind of bowely symptoms that you get with irritable bowel syndrome, with bloatedness and gas. And the gut and the brain are linked. What I would say is, there are different ways to get progesterone. So the Mirena coil is a good one, and this now body-identical micronized progesterone where we minimize those side effects. So just speak to your doctor to make sure you've tried that particular type of progesterone and see if that works better for you.
Varna and lots of others are asking about testosterone. So do you need to get testosterone on a private prescription, or can your GP do that?
Right. So testosterone does go down in women during the perimenopause and menopause. That is absolutely true. Now, a lot of the focus has been on estrogen and progesterone traditionally with HRT. For the NHS to prescribe testosterone, and we can, probably not through your GP, you might have to see either a menopause specialist or a gynecologist. So I personally don't feel qualified enough to prescribe testosterone, and I feel okay to admit that. And so I would refer to someone who is more informed on this than I am. But I do know the indications for prescribing testosterone on the NHS, and it is low libido. So if you've got low libido and other things have failed, it can't be the first line. So we've tried other things to help with your libido, then you can be referred for testosterone supplementation on the NHS.
Kind of frustrating that it's not also prescribed for lack of focus and lack of motivation at work, because it feels like, if you can't provide sex, then we care about it. But actually, for a lot of women, lack of testosterone is affecting their work and their motivation, their general mojo.
You're absolutely right.
If you want testosterone, should you go in and say, I don't want sex?
Well, yes, and that should be the truth.
Oh, thank you for being honest. Thank you. Look, it's not the way it should be. But for a woman, if she needs and wants testosterone, that's how she gets it.
Yeah. The issue with testosterone is, it absolutely works for lots of women, but we don't have the data for women to give us the exact right doses needed, like we do for estrogen.
Right.
And so it becomes a bit of a guessing game.
Yeah.
And that is
that sounds like the whole of women's health.
Yeah, and that's where the problem lies. And that's why you have to be referred to a specialist who knows what they're doing. Lots of people go private for testosterone. They do, and that's the reality of the situation. And that I completely understand. The British Menopause Society is really careful about this because we just do not know what the right dose is, what the long-term effects are. And so you really have to have a nuanced, balanced conversation with your provider. And often these private providers, I would just say, please, please, please explore all options.
Okay. So Mickey says she's on 4 pumps of Oestrogen and a Mirena coil, and she's got no libido at all. And others are actually replying to her on Facebook and saying she actually probably needs testosterone.
Yeah, that's quite likely if she hasn't tried anything else. So there are license for libido. There are certain antidepressants, and I know lots of women get put off by that word antidepressants because they feel like they're being fobbed off. But there is evidence that certain antidepressants can help with libido, and you can try them first.
Okay.
Psychosexual counselling, exploring the ideas of why your libido is low, is important as well. But then yes, testosterone is an option, and she can get that on the NHS for those symptoms.
Fiona says HRT and joint pain, stiff knees, limiting high impact exercise, and frozen shoulder, which is I didn't realise it's such a common symptom of the perimenopause. Would you recommend an increased dose? And others are asking about shoulder issues, apparently called menopause shoulder in some countries.
Yeah, it is. So estrogen is vital to reducing inflammation within joints, improving lubrication within joints, and flexibility within joints. So when estrogen levels drop, joints, tendons, muscle lining, sheaths and things that go over your joints all become shorter and stiffer. And that is what causes that stiff shoulder pain with frozen shoulder, menopause shoulder, can cause joint pain. That's a really common symptom of the menopause. So by giving HRT, people find that their joint pain does get better. Flexibility can come back. Things like frozen shoulder, menopause shoulder, often HRT isn't the only thing that will solve it, because by that stage, there's inflammation, micro tears within those lining of the muscles. And so physiotherapy exercises are needed as well.
I love my estrogen gel so much. I'm really in honeymoon phase with HRT at the moment. I look at it and I cup it to my face.
You have got your balance just right, haven't you? With your estrogen and progesterone. I love it.
So good. And I think I was really, a few of my friends are saying, oh God, I can't believe you started it. You're too young, or it makes you feel really old talking about it, which is the taboo around menopause is so much about sexism and ageism. And I think, no, I'm not waiting till my house is burnt down before I call the fire brigade. This is here. It's on the NHS. My GP was amazing, took me through all the conversation around it. And but I think there's a lot of ageism around HRT and the menopause.
Even within the medical profession, you're too young to have it. Right. It's a common thing that's heard.
So there's quite a few questions on what would be a good natural alternative to HRT, either through choice or breast cancer or blood clots.
Yeah. So it's all the stuff that we harper on about all the time.
I'm not going to say legumes.
I'm going to say legumes. I'm going to say diet is important. A good, healthy gut microbiome is vital, because the gut microbiome actually help with estrogen production. There's certain bacteria within the gut that help break down estrogen and decide how much is reabsorbed as well. So by having a healthy gut microbiome through the food that you eat, the sleep that you have, the exercise that you do, how much water you drink, all of those contribute to it. That can help manage estrogen levels a little bit after the menopause. And then it's kind of things like making sure, with the hot flushes and bad quality sleep? What are you doing around your sleep cycle? In terms of, are you getting enough natural light in the daytime? Is your room temperature okay? Does your routine before bed, does it lead to a better night's sleep? Exercise is super important for your mental health. That can be a problem in the menopause as well. So those kind of things are really important, and they also impact your bone health and your cardiovascular health, which can be a problem after the menopause too. So those are the things that we should be focusing on, whether you're on HRT or not. But if you're not, certainly yes.
Absolutely. So it's time to wrap this episode up. And I think my final thought on this is, don't suffer in silence. Don't wait until you've got 8, 15 different symptoms. I just don't think it's necessary for women to suffer because, want to get on with it. Obviously, lifestyle changes are hugely important and have done wonders for me. But if you are unhappy and suffering, go and see your GP.
Yeah.
And don't be scared of HRT. And you're not too young for it if you're unhappy.
Yeah. If you've got symptoms, that's what HRT is there for.
Right. Well, we've covered off a lot of areas. We've answered a lot of questions. You've been amazing. But it's not unlikely we will come back to this subject again.
Yeah. And I think I probably should just add, I am a GP. I'm not a menopause specialist. And if you've got really specific questions, a menopause specialist is the person to go to.
All right. It's time for Chat GP. We've got one from Christine that says, I had a hearing test and was told I have a bulging eardrum. I've never heard of that one. I have a dull ache in my teeth and experience a nasty taste in my mouth. I've been prescribed omeprazole.
Yeah.
But so far it's not making any difference. I'm on a long waiting list to see an ENT, which is an ear, nose and throat specialist. Do you have any advice to help me?
I do have some advice there. So that kind of strange taste in the back of your mouth and your pain in your teeth, it sounds like they've put it down to something called silent reflux, where you get acid coming up from your stomach, but you don't get the normal heartburn symptoms. It gets past the sphincter at the top of your throat and can get into the back of your mouth and your throat area. And that can cause that weird taste in the back of your mouth. It can cause pain in your teeth as well. We call it silent reflux because it doesn't cause the normal heartburn. Whether it can cause a bulging eardrum, I'm not quite sure. I don't think it can. What can cause a bulging eardrum and hearing issues is fluid behind the ear. So when we look at the ear, when we have a look inside of your ear, we can see all the way down the ear canal to the eardrum. But there is a tube behind the eardrum called the eustachian tube, which joins your ear to your throat area. So it drains kind of mucus from there. Sometimes you can get fluid buildup in that eustachian tube, and that can cause a bulging drum because it puts pressure on that drum. So there is something you can do about that. There's a device which you can buy either online or from the chemist, and it's called OtoVent. And essentially it's a little tube with a balloon in it, and you put it up your nose, the little tube, and you try and blow the balloon through that device. You can't do it, but what it does is balance out the pressure and allow a drop in pressure, which allows some of that fluid to drain through the tube down into your throat. And honestly, it's worth a try. It works really well.
Is that a bit like when you get a pressure imbalance?
Yeah.
And you...
On an aeroplane,
Yes.
yes, it's just like that. But you can get a device that helps balance it. So I would say keep on the omeprazole because that will manage your acid, but try this thing called OtoVent, OTOVENT. It's really useful.
Very clever, Christine. We really hope that helps you. It's time to wrap up this week's No Appointment Necessary. Thank you so much for tuning in as always. And don't forget to follow, subscribe and comment. We love to hear your comments.
Yeah, and join our Facebook community group. So until then, no appointment necessary.